We're now going to shift gear and hear from our last witness of the evening. We have a confessing witness tonight. A confessing witness is a person from the white, quote unquote, racial group who has recognized the danger in the system, who's decided that he can no longer allow for the racial biases, the racial inequities to persist, and wants to find a way forward. And our speaker tonight has dedicated his life to finding a more just and equitable way to deliver healthcare in our nation. I want to introduce a former Texas resident who's now made Charlotte his home, Dr. George Bohmfalk. George?
All right, thank you very much, Rodney. Well, this has been quite painful this evening, listening to all these very sad stories of shortcomings and discrimination in the healthcare system. I've been hearing a word in the last several months that I haven't heard much before, and that term is unconscionable. And aren't these stories unconscionable? And aren't all the disparities and deaths of the African community, minority community in the COVID pandemic unconscionable? So it really is a difficult time. And when it comes to recognizing and acknowledging and doing something with the problem, I'm proud and happy to play a part in that. So I've got a lot to confess. So going back to my background, I was raised a Methodist, and I learned that there's two kinds of sin. There's a collective sin that we all do as a body, as a collective, and then there's individual sin, and both need to be addressed. In the Methodist Church as a young boy, I learned the congregational prayers of confession, where you say, "We have sinned," and also individual prayers about "I have sinned." And I've only recently, in the last year, less than that, learned about the collective and individual sins of racism, and our need to name it and confess it and atone for it. So the question is, does racism operate in healthcare? Yes, we've learned tonight, and most definitely operates profoundly in healthcare, and I name and confess my role in it. Historically, I went to medical school in San Antonio in the 70s. In my class, there was one Black student. There were 0 Black faculty. So are we surprised that that single Black student dropped out of school after a couple of years? I never engaged him. I hardly knew him. I feel terrible about that. Went to practice medicine in an East Texas town on the Arkansas border, literally 10 miles from Stamps, where Maya Angelou lived as a child, and where she had the experiences that she wrote in I know when the caged bird sings. She recounted many episodes of racist medical treatment in her life. I'm not a bit surprised. In that town, when I arrived, there was one Black physician. He was not replaced when he retired. I never engaged him. We had a racist old white doctor who had a segregated waiting room in the 1990s. It's just incredible to believe that I never engaged him. I never challenged him on how he could do that. One of the largest multi-specialty clinics with about 120 doctors did not take Medicaid patients unless they had to in the emergency room. They didn't electively accept Medicaid patients. And I talked to the administrator, and he told me it's because the other patients didn't want those people sitting in the waiting room with them. I never did anything about that. I recognize in retrospect that I and some colleagues treated our Black patients maybe a little bit dismissively. I like to think that we gave them good care, but as Dr. Sachs mentioned, if you looked at the numbers, probably the outcomes were a little bit different. I was just oblivious and ignorant and blind. I exercised the highest of white fragility, or white privilege rather, and they were questioning my behavior or our community's behavior. And I regret not challenging those fellow doctors and other people about things that I saw go on and accepted. But the events of the past years, if they've opened so many people's eyes, so certainly opened mine to enforce me to confront my racism in the countries. Like so many people, I used to blame the victims. I didn't understand why people would run away when they were stopped by the police, even if they hadn't even done anything wrong. The George Floyd incident was really a tipping point for me, and I think most of the world. We We can no longer make excuses and blame the victims. So I started reading some books. And the first one was this book, White Fragility, that you're probably all familiar with. And it just, again, awakened me to my collective and systemic racism, my personal white fragility and privilege. And I finally saw my role in perpetuating racism. I became involved with Medicare for All movement about 4 years ago with Dr. Sachs. But at that time, I didn't appreciate the racial inequities uh, in racism in the healthcare system. It's a huge blind spot. I'm embarrassed now to read things that I wrote, articles and letters to the editor and talks that I gave to groups about Medicare for All, and never mentioned any aspects of racism. It was there all along. We just had the privilege of not seeing it. So I realized that I need to confess and atone for both personal and collective sins of racism, especially in healthcare. And to me, I think one of the greatest ways to begin this atonement would be advocating for Medicare for All. It's not going to cure racism, but it would create an enormous basis towards doing so. It would immediately provide equal access. It would not discriminate in payments to affluent patients and poor patients on Medicaid or those without insurance. It will finally provide fair funding to inner city and rural hospitals whose patient base is weighted towards those folks with bad insurance and Medicaid. So the hospitals do poorly just because of the socioeconomic level of the patients they're treated. Medicare for All would eliminate cost sharing. It would eliminate problems that you've heard so many people describe about not having the deductibles and the co-payments to pay for a test or a scan or a doctor's visit. There's clear-cut scientific evidence that eliminating these upfront payments in order to get care will save the lives of many people who just can't afford them. And then clearly, as Dr. Sachs and others have mentioned, a Medicare for All system would eliminate and reduce the racial healthcare disparities that don't exist in places where people have equal access to care, like in the military and the VA system. And you've heard that these differences are not differences of race, but access, income, and other social determinants. So healthcare for all is a moral issue of racial and healthcare justice. And I'm learning that winning it is going to require a multiracial movement. We are all in this together. So I am obviously not a lifelong activist. I feel like I'm now making up for time that I sat on the sidelines during previous movements in the 60s, the civil rights and the Vietnam War. And I know that we need to change what we can no longer accept. So I've vowed to become an anti-racist for the rest of my life. And I'm thankful for this opportunity at atonement and reconciliation. I read about Albert Einstein after he came to America from Germany, Nazi Germany, escaping that racism. And he saw what we had in the United States. And he said, I can escape the feeling of complicity in it only by speaking out. I do not intend to be quiet about it, and neither do I. So, thank you very much.
Thank you so much, Dr. Bohmfalk. It's wonderful to hear your testimony. I heard you talk about the experiences that you had, the things that you saw even in your background. And I appreciate you making that confession of where you feel as though you participated, were complicit and complacent in that larger realm. But your decision to atone for that by trying to find a way to create greater healthcare justice for all people, greater access to all people is significant. It's the kind of thing that we really do need to see if we're going to begin to move beyond the racial inequities that we've talked about tonight in relationship to healthcare. I'm grateful for your witness. I'm grateful for the example that you have set. And thank you so much for being with us this evening.